I guess I'm tall. Get me on stage. Sorry.
All right, good evening, everyone. Check, check, mic check. Welcome to Representative Underwood's town hall tonight. I'm going to ask you really quickly just to silence your devices or your cell phones, just for a courtesy as we ask the questions. And then to welcome Representative Lauren Underwood to Sycamore High School.
Thank you.
I'm now going to welcome Emily and Emma, two high school seniors here, to come up to lead us in the Pledge of Allegiance. So if you all will stand, please. Thank you, Emma and Emily. We're going to take a moment right now and recognize some local elected officials. We have the mayor of DeKalb, Jerry Smith, is here tonight. And we also have the mayor of Sycamore, Kurt Lang. Briefly just go over the rules tonight. So if you choose to ask a question, please just make sure you limit it to one question, just so we can get in as many questions as possible. And if you feel like you didn't get your question in tonight, please write it on your note card and leave it with someone in the front, and we'll be sure to get those answers questions. And now I'm going to turn it over to Representative Lauren Underwood.
Thank you so much, Shelly. So good evening, everybody. I'm so excited to be here with you tonight. It's been a real joy to be able to kick off our time as your representative by doing these town halls. We had two over the weekend, and we're wrapping up here in Sycamore tonight. I'm really delighted to be back here because citizen engagement is really the hallmark of a strong democracy. And so I want to thank each of you for coming out and asking your questions, because it really truly does inform the work that we do on your behalf. I wanted to give you an update about what we've been working on. It's been a little over 6 weeks, and it feels like a little bit of a whirlwind coming out of the shutdown. But despite that, we've been hard at work, and the first day that we were sworn in on January 3rd, we obviously did the ceremonial activities, but also had some big wins that day. I had two provisions included in the rules package. So at the beginning of every Congress, there's a set of rules that we vote on that really govern the way we do the business of the Congress. And our two provisions had to do with preventing sexual misconduct in the halls of Washington. You see, there had been a big Me Too movement that I know that you're aware of across the country, but it had not quite come to Congress in the same way. And so the two provisions that we passed, one prevented sexual relationships between members of Congress and committee staff, and the other prevented non-disclosure agreements from prohibiting victims and witnesses from coming forward with information or allegations. Those are two really important things to make sure that we have a safe and effective workplace. And they're really commonplace industry standards that just had not been applied to the Congress. My first speech on the floor of the House was about protecting pre-existing conditions. We know that over the last several years, our healthcare had been under a threat of being taken away by a Congress and an administration who have been very clear about their interests in weakening and eliminating the Affordable Care Act. And so did a speech on the floor and then swiftly moved to vote for the House to defend the Affordable Care Act in the Texas versus Azar case. It's a little bit unusual that we would have a Department of Justice not defend its own federal law. But this Department of Justice and the Trump administration has decided not to. And so it was up to the Congress to really step in. And so the House of Representatives is going to do just that. We voted to open up government. So there was a shutdown for 35 days that we inherited on our swearing-in day. And so I'm really pleased that we have now voted to reopen government under the CR and then pass that spending bill last Thursday to ensure that we are not going to be faced with another shutdown threat. It has been something that was very damaging to our national economy, but it hurt a lot of people locally. You know, in our district, the Illinois 14th, we are home to the most air traffic controllers in the state. Given the proximity to O'Hare and to Elgin and the Aurora Airport, and so we heard really loudly and clearly from those individuals, plus all the TSA agents. We heard from a lot of folks in the agriculture sector because the implementation of the Farm Bill was held up by that shutdown and the like. And so thrilled that we have a fully functioning, open government, so now we can do the work of the Congress in regular order. Our first bill that we put forward protects people with pre-existing conditions and bans what we call junk insurance plans. So these are healthcare plans that are not required to offer coverage for people who have a pre-existing condition. They're not required to cover things like inpatient hospitalizations or prescription drugs or maternity benefits. And under the ACA, particularly in the Obama administration, those plans were only able to be offered for 90 days. Well, this Trump administration has really lifted up these plans and has offered some regulations that would extend the amount of time that they can be offered for 3 years. So from 90 days to 36 months. And that's problematic. People buy these plans thinking that they have full coverage. And then if they get in a car accident or an unexpected cancer diagnosis and they go to use their coverage, they get a pretty shocking reality. And so what our piece of legislation does is prevents those junk insurance plans from being offered as a long-term solution, only again the short-term nature that they were originally designed to be offered. In the meantime, while we're still working on that bill, and it has had a hearing, I expect it will come up for a vote on the floor of the House either the last week of February or early March. We're also working to lower your insurance premiums, lower out-of-pocket costs, and make prescription drugs more affordable. H.R. 8. H.R. 8 is an important bill that's going to offer universal background checks on every gun sale in the United States. And we talked about how even, in this community 11 years ago, there was an awful shooting at Northern Illinois University. A year ago, Parkland, Florida, there was the awful shooting, and then just last week in Aurora, we are a country that is being impacted by gun violence, and I certainly am committed to acting to make sure that these do not continue to happen, that children do not have to continue to fear going to school. We don't have to have workers fearing that a gunman will come in and at their job. And so this is the first step at the federal level. This bill will come to the floor for a vote next week. And I will be voting yes for that bill. The bill has enough co-sponsors that we are in good shape for passage, but it does need to go through the Senate. My hope is that the Senate will also display the same amount of courage and support this bill that has so much support across our community and the United States. And it's also my hope that our president will have the courage to sign it because it's a very important piece of legislation. I also was excited in the last couple of weeks to help introduce and co-sponsor the Family Act. The Family Act is an important piece of legislation that offers paid family leave for anyone who has a birth in the family, an adoption, serious illness, you have to take care of a loved one. So it's not paid parental leave, it's paid family leave, and it would offer it to all employees. And that's a critical step forward to ensuring that these workplace protections and workforce protection are extended to all workers. We also know that equal pay remains a challenge. In the 14th district in Illinois, women make 71 cents on the male dollar. And so we are co-sponsoring the Paycheck Fairness Act to help solve for that. I've been assigned to 3 really powerful, exciting committees in the Congress. The first is Education and Labor. The Education and Labor Committee has jurisdiction over K-12, higher education, worker protections, labor unions, and employer-sponsored healthcare. So that's how I got to the committee on the healthcare piece. Then I'm on the Homeland Security Committee. I'm the vice chair of that committee, and that committee has responsibility for cybersecurity, emergency preparedness and response. We have oversight over FEMA. It's doing immigration and border security and election security, which is something I think is particularly important for us, given that we know that Illinois was one of the states that got hacked in 2016. And so we are taking a close look and working with DHS and the other related agencies to make sure that that doesn't happen again in the United States. And one of the big marquee bills to help ensure that election security is Bill H.R. 1, the For the People Act. It's a pro-democracy bill. It includes election security, but other things too, like requiring disclosures for the political advertisements that you see, particularly those that are not paid for by candidates, but these groups, these 501c4 groups. And you saw these ads last fall. They definitely played them here in the Philippines. But oftentimes you don't know who is behind those ads. Gerrymandering and the maps. It's a big bill that offers important reforms so that individuals and citizens have faith in our democracy and the integrity of our democracy. The final committee that I'm on is the Veterans Affairs Committee, and very excited about the opportunity to help make sure that veterans have the best health care and economic opportunities for themselves and their families. And so looking forward to working with all of you to ensure just that. Want to make a quick note about the SALT deduction. So we know that our district, the Illinois 14th District, is among the top in our state, among the top in the country that were negatively impacted by that change in the tax reform law in 2017, which put for the first time a cap on the amount of money that filers could deduct as a result of state and local property tax, or state and local taxes, SALT. And so I'm working with our neighboring representative in Illinois 6, Sean Caston, to appeal to the IRS for some, basically we know that a lot of people did not withhold enough over the course of 2018 to make sure that people aren't getting doubly penalized, one. And then two, to come up with a solution for the SALT deductions. And so we are working on that issue. That's something that's of interest to you. Please talk to my team who's here. We are trying to find a solution that will help families across the 14th and across the country who were really singled out and unfairly penalized with that kind of a tax policy. The final thing I'll say, and I want to thank the students who are here for leading us in that moment of silence, but you know, there's a lot of families who are hurting tonight, thinking about the families of Clayton and Trevor and Russell and Vicente and Josh. And I ask that you pray for their families and their coworkers and friends during this really difficult time. You know, we're an incredibly strong community, and we're going to need to come together in order to move through this. And I'm just heartbroken and devastated that we have to once again address this type of a mass shooting in our country and in our community. And I'm optimistic that together we'll be able to make sure that these kind of actions don't become commonplace. And with that, I'd like to thank you again and looking forward to your questions.
Okay, before we begin questions, just to reiterate, please limit your questions to only one question. We have two people with microphones coming around, so if you have a question you would like to ask the representative, please raise your hand and they will find you and allow you to ask your question. We open the floor up.
We also ask that would you please stand and state your name and where you're from.
Kenneth Medikevich from Sycamore. I just want to know if you're running for president.
Hi, Kenneth. Thank you so much. No, I am absolutely not running for president. There is zero chance. But I am very excited and honored to be able to do this work at this time for all of you. We get 2 years. to do some incredible work. And so looking forward to hearing from each of you and working together because we know that there's a lot of opportunity and need. So thank you for the question and maybe for the vote of confidence.
Hello, I'm Mark Petrowski. I'm the DeKalb County Board Chairman from
Hi, nice to see you
Portland.
again.
How's it going? So one of the things I wanted to ask was, in which way do you think you and your team will be able to work with local governments to be able to get us kind of recognized in some federal legislation? Because I know a lot of times there's different things passed and it's not always thought about how that's going to have effect on other local governments.
Yes, thank you for the question, and thanks for being here. One of the things that we've made a priority to do in these early weeks since swearing in and taking on this role has been to try to sit down with the state and local elected officials. So we've been setting up meetings with all the state reps and state senators in the district. There are many. Trying to meet with all the mayors and all the county board presidents. So we will be sitting down and talking. What I found is that, we have 7 counties in the district. 7 counties and many communities that could not be more different. Couldn't be more different, right? Crystal Lake is so different from Sycamore, it's so different from Shorewood. And there's unique opportunities to serve the people of those communities, but we wouldn't find out unless we show up. And so we've been hearing about needs for water treatment plants, been hearing about needs for tollway access, been hearing about all kind of fun stuff. And looking forward to working with those municipalities and those local leaders to make sure that we can bring federal resources into the 14th. My goal, my team has really 2 big goals. We sat down and did some strategy planning. The first goal was to bring resources into the 14th. So money, expertise, help, broad resource. Second is to make sure that we are passing bills that support families. It's that cut and dry for us. And this is one way that we can ensure that we are bringing the needed resources that we can. So on the horizon is an infrastructure bill. We've heard the president speak about a desire to help rebuild America. He spoke about it during his campaign. He spoke about it during the State of the Union a couple weeks ago. And I think the House is gearing up to put together a big infrastructure package late spring, early summer. And so what we're doing is we are trying to determine what those requests might be so that we can make sure that, as there are funds available, that they can come here. And so looking forward to supporting this community in DeKalb County to help make sure that some of the resources are coming here as well. Thanks for the question.
Hello.
Hi.
I'm William Mitchell. I live here in Sycamore. I'm a retired teacher. I have had the unusual opportunity this year to travel from coast to coast and from north to south. And I have become particularly sensitized to the problem of plastics in our environment. I see very little, if any, recycling except at state and national parks. It's just recently been revealed that plastics are breaking down on the beaches and washing back into the ocean and putting small particles of plastic, even at the molecular level, into the guts of fish and other animals in the ocean and lakes. We need a green revolution because there is scant evidence that I've seen of any kind of, as I said, recycling or desire to clean up the environment. I was in California and there was a large amount of rain. The material washing down the sewers and then into the ocean with rainwater was astonishing. Florida, I saw a few people picking up stuff off the beaches, the smaller particles even. And so I'll leave it there, but we do need a green revolution to begin to conquer this whole thing of toss away plastics. Thank you.
Thank you, Mr. Mitchell. I appreciate your comments on that issue. There's been as the price of plastic and other disposable materials has come down, we treat it as such, right? It's just a throwaway item, and oftentimes it's easy to forget that there is a lasting footprint. And so I think that here in the 14th, we're really cognizant about sustainability and conservation efforts, but we need to make sure that our policies do reflect that, and making sure that we have funding streams and making it convenient to do the right thing as well, right? So the incentive is there to recycle, to reuse, to reduce, and not just to use the quickest, easiest, most disposable item. Thank you.
My name's Dee Austin from Sycamore. I was wondering, what's the fundamental difference between the new Family Act and FMLA?
Sure. So the Family Act is an important next step because FMLA is one law where some people, it doesn't apply to everybody. So the Family Act would apply to all workers. It's the first thing. The second thing is the Family Act offers up to 66% of a worker's salary that they are able to be paid up to $4,000 a month. FMLA at its core just protects your job. It does not ensure payment. So it ensures that you cannot be let go for the birth of a child or having to take time off for adoption or take time off for caring for a loved one. It does not ensure that you are paid. And so those, I think, are really critical differences and advancements that help families be able to afford that time. And then the last thing is FMLA has been applied where some employers have discretion to deny it to some individuals. So for example, LGBTQ folks oftentimes were not allowed to take that family and medical leave for, say, an adoption of a child. And the Family Act ensures that all individuals have equal access to these kinds of important provisions in the same way that some employers did not offer paternity leave benefits, right? They only offered maternity leave benefits. And this is, again, a gender-neutral advancement to offer paid leave to all workers. Thank you.
Hi, Francis Lawrence from Lisle. I'm not in your district, but I did go to your town hall last night, so I wanted to come back again.
Okay.
My question relates to equal pay for equal work.
Great.
Whenever I hear politicians talk about equal pay for equal work, it's almost solely in the context of gender disparity.
Sure.
Whereas in fact in the non-union corporate workplace, wage disparity amongst workers doing exactly the same job is rampant. I worked for a company for 13 years. There were thousands of dollars difference between workers doing exactly the same job. And I think that if you analyze the data, you wouldn't find a gender disparity in this company, but you would find a major disparity between the pay of workers regardless of race or gender. So my question is, does your Paycheck Fairness Act tackle equal pay for equal work, or is it solely in the context of gender disparity?
Thank you for that question. So one of the things that I was most fascinated by when this legislation presented itself was how many, we're going to use an example of a company, and I'm not saying, this is just hypothetical. This company I'm going to mention has not been proven to have been violating this rule. But let's say that we are all pharmacists at CVS, and we work at different locations. And the existing equal pay rules, like the Lilly Ledbetter Act, it required, if you, sir, had a claim, an equal pay claim, that it had to be with a colleague that worked in your physical location. And so if your colleague at the CVS in Naperville, with the same background, same skill set as the pharmacy manager, was making $5,000 more or $10,000 more, you could not come forward with an equal pay claim. What this law does is allows people who work for the same company, who have the same skill set, same qualifications, same background, and who are having a pay disparity regardless of gender or race or what have you, to be able to come forward, but it does not require them to be at the same physical location. That's very important for these companies that are national companies that have many locations, and there's a wide pay scale that ends up being unfair to the workers. So that's one important area. The second important area that addresses your question is it allows for workers to come forward on a class action basis. That's important because in the example that I just offered about these pharmacists, if a pay differential, right, or disparity is identified, it will be clear among the salaries for all the individuals at that level. And under the existing rules, people would have to go one by one and opt in. And a fix that could just be really administrative, right? You know who the workers are who are experiencing this type of inequality. And so it allows for those workers to be able, in an easier way, to offer a class action complaint and then have it remedy as a group. And so I think it's really an important advancement, but it does not limit the opportunity to rectify this situation because it's not limited to just gender or race or ethnicity. We have a question up front. Yeah.
Hi, Laura.
Hi.
I haven't seen you since the election, so congratulations.
Thank you.
My name is Paul Stoddard. I live in DeKalb, just outside your district, but I follow you closely.
Yeah.
You touched on it briefly when you were going over some of the things you were working on, and they're all very important issues, and I don't mean to demean any of them. They're all vitally important, but you talked about gerrymandering and other fair election type things, and hopefully transparency and the 504Cs and all that. But I just want to say, to my mind, that these are really the most important issues, I think, that are facing our country. We have to be able to have fair elections, we have to be able to have a representative government in order to come up with the solutions that are going to work for everybody. And when one side tries to stack the deck so that they win, regardless, we're not serving the people of the country very well. So I want to encourage you to really follow up on that and make that one of your main priorities, if I can.
Absolutely. So I was an early co-sponsor of that bill. I would encourage everybody to take a look at it. This is something that is, that would touch, if it gets signed, right, it will pass the House, I'm pretty confident, but if it gets signed into law, it would touch the lives of every single voter in this country. And it's important. And it offers automatic voter registration nationwide. It's something that we have here in Illinois. It would, as we mentioned on the 501c4s, would also offer some important disclosure requirements for super PACs. And these organizations that are allowed to spend unlimited sums of money to influence an election but are not required to disclose who their donors are, right? These kinds of protections are important because a lot of people feel like their vote doesn't count or their voice is not able to be heard because someone else can come in and spend millions and millions of dollars and drown out the voice of the individual voter. I believe that in our representative democracy, no one is more important than the voter. And we need to make sure that our system is set up, or the citizen, right, the individual. And we need to make sure that our system is set up to reflect the significance of each and every one of us.
You have a question over here?
Thank you. Hello, my name is Brian, and I'm here with my friends from the DeKalb County Libertarian Party. You said you were the vice chair in the Veterans Committee.
Homeland Security.
Homeland Security. As a Libertarian, one of the things we believe most is the best way to take care of war veterans is to not send them off to war and make them veterans. An issue that was not talked about in the last president election is the invasions that we've done. We had one President Bush who invaded Iraq and Afghanistan. We're still there. Then we had President Obama invaded Yemen, and Syria, Pakistan, Somalia, and to a degree we're still in Libya. As a U.S. rep, you have influence on this. I don't get a chance to ask this question that much. Do you think we're getting our tax dollars worth in these countries? Do you think it's worth it to us, or do you think maybe we can start pulling out of these countries and not be policing the world and instead focusing on what we have here at home? Thank you.
Thank you for your question. Last week, when we were in Washington, we voted for the first time to make some recommendations about Yemen. You see, in the executive powers, the presidents have taken some leeway to move the United States into conflicts when in the Constitution, the war powers lie in the Congress. But there have not been war declarations really since September 11th, I think. And we have now, as you rightly mentioned, sir, found ourselves in many conflicts in many different countries around the world. Part of the obligation and our role as members of Congress is to make sure that we are engaging at an appropriate level and we have appropriate oversight over what's happening in each one of those countries. And so I can tell you that one of the things that we're doing is trying to find out, in fact, what's going on. Because as you know, in the last several years in Congress, there has not been that same level of oversight to find out how our tax dollars are being spent, what the goals that we hope to accomplish in each country are, etc. And so proud that the House did pass that resolution about Yemen, and hopefully we can see this reduction that the president talks about in a safe, measured way, right? So we've heard the president talk about pulling out of Afghanistan. We've heard the president talk about pulling out of Syria. Those two countries, in my opinion, are not stable. And we have spent many years, many lives, many resources investing in those nations. And so the removal of U.S. forces should happen in a way that can ensure regional stability so that we don't pull out and have to go right back in 6 months or a year. And so, I'm encouraged that we have an administration that's forthright and who's coming forward to brief us. Even during orientation, we had an opportunity to hear from the chairman of the Joint Chiefs about his priorities and how they are looking into this force reduction in these countries in accordance with the president's wishes. And I know that that's going to be an area for oversight and continued engagement in the House.
Question here?
Trish Spector in St. Charles, it's so exciting to see you up here and coming back and doing these town halls. Thank you. Could you talk a little bit, perhaps you did this in your opening remarks, which I did not get a chance to hear all of, but could you talk a little bit about what you feel you would be able to do in your position as vice chair to correct the situation down on the border with all the family separation and all the children?
Sure.
That's just such an awful situation, and I've just felt so helpless watching that, and I'm very, very concerned about that. Very, very concerned about the border security in this wall business, and could you speak to all of that, please?
Thank you for your question. So, as you know, the shutdown was really predicated on this question about border security and the president's wishes for a certain amount of money to build a wall. Then it became a structure, and then it became a physical barrier. At the end of the day, the compromise that we agreed to was a certain amount of money for physical barriers and fencing in certain places. And as you know, the president has come forward with this emergency declaration to try to pull more money from other areas to go around Congress and, as he says, build the wall. I have significant concern with that approach. I think that it is completely inappropriate and goes around the Constitution's delineated roles, which is the Congress has the responsibility to appropriate funds. It is not something that the president can do. On a bipartisan basis, both the House and the Senate approved a pot of money. And I am encouraged to see those, I think it was 16 states, file their lawsuit today, including the state of Illinois. I know both the House and Senate are working on a resolution. That's the other recourse that we have in the Congress to put a stop to this. And so that's the piece on border security. I don't want anybody to walk away and think that border security is not important. It is incredibly important. And we need to make sure that we have enough officers at the border and at ports of entry, that we are engaging and using the technology that we know that will detect and stop the inflow of drugs coming into our country, and that we have the ability to even have things like judges that can help move through the backlog of cases of people who have claims of asylum or who are requesting immigration papers to come into the United States. Those require resources. Physical barrier does not supersede the need for those resources. And I'm very pleased that the spending bill that we approved last Thursday allows for those resources to flow to secure the border. Now, to your question about the family separation policy, I was incredibly upset to see those images over the summer. Very disappointed in the actions of the 115th Congress. And so now that I'm on the Homeland Security Committee, one of our first actions is to bring Secretary Kirstjen Nielsen, who runs the Department of Homeland Security, in to testify before our committee. She initially refused to come, which was unacceptable at the beginning of February, but we were able to find a mutually agreeable time, and so she will be coming to testify in front of the committee the first week of March. And I intend to ask her about just this question that you raised. Because what we've heard coming out of the administration is, gosh, we can't find the kids, and sorry, we don't know where they are. That is unacceptable. The United States in 2019 has the technologies, we have the staff, we have the resources that we need to reunite thousands of children with their parents, whether they're in the U.S. or not. We know we have the capability. It needs to be a priority, and we need to find a way to work together to get to yes. And that, for me, is going to come with oversight. We have to hold them accountable for solving this problem. And if it's a resource need, we will provide the resources. But in my opinion, it needs to happen. It needs to happen timely. It needs to happen quickly. This should not be something that drags on and families are getting reunited in 10 years. Right? We have these children who are here in custody. It is my suspicion that there are records that are being kept either by DHS or Customs and Border Patrol or by these organizations that have taken the children and brought them to communities around our country. There are records. And so we just need to make sure that they get in the hands of the folks in charge of the reunification. Thank you.
Question over here.
My name is Barbara Votal. I'm from Sycamore. One of the things that we haven't discussed in healthcare is that our population is getting older. I'm scared to death I'm going to end up in a nursing home, stuck in a wheelchair for 12 hours a day, and no one's going to take care of me. My daughter is a nurse. She works at a critical care facility. When she was hired, she was told she would have 5 patients. She's now up to 7, and a lot of that is being driven by Medicare and Medicaid. And is there something that will be done to address this problem?
Yes, there are safe staffing bills that have been proposed for several Congresses. I think one of the opportunities in having a Democratic majority is that legislation like this can move forward because we know that it's a patient safety issue. If nurses and other providers have too many patients who are being forced to work mandatory overtime to take care of folks, then more mistakes happen, symptoms get missed, and ultimately there's poor outcomes. These are avoidable. It's avoidable by making sure that individual providers are not overloaded with too many patients. And so I'm encouraged that this year we're going to be able to see some movement on these policies, as you mentioned, and I'm excited to be able to lead as part of these conversations. There's only 2 nurses in Congress. One is Eddie Bernice Johnson out of Texas, and the other is me. And so we're working together to make sure that we can, one, support a pipeline of nurses and other providers so that we don't have these kind of regional shortages that we see happening all around the country. And to make sure that we have these kinds of patient protections in place so that people, when they enter medical facilities, get the very best care. Thank you.
Question right here.
Oh, you get full folded. Representative Underwood, I'm a 6th district convert over here, so I'm really a Caston person, but congratulations on this victorious win. That's fantastic.
Thanks.
My name is Bob LeBeau. I'm a professor at Northern Illinois University, and I educate healthcare providers. I'm also a physical therapist.
Great.
So kind of to add to that whole healthcare, I'm very excited to have a healthcare provider representing us in the United States. So I would love to ask you what your thoughts on the opioid epidemic and how to cure it, and not just the nonsense that President Trump is saying. Sorry about that. In Europe, physicians in the United States prescribe 3 times the amount of opioids as our European counterparts, and in 1990 we're 3 times more than that. So there's a lot of the big pharma, I think, really aggravating us and causing us to be in wheelchairs and in nursing homes rather than being healthy participants. Could you give me your ideas on the opioid crisis?
Yes, thank you for that question. So in the last Congress, they passed a bill that has the most dollars ever set aside to combat the opioid crisis. It was this landmark victory. And I think that there would be, under conventional wisdom, to say, check that box, the job is done. I do not take that viewpoint, because we know that in our district, for example, the 14th, we have a county that does not have a hospital. Kendall County, home to Yorkville and Oswego, does not have a hospital in their county. Similarly, if you look at the data and statistics, Kendall County has lower, you would think that they had lower levels of drug use and abuse because they have fewer deaths on record. They have fewer deaths on record because they don't have a hospital, right? If someone overdoses, they get taken to Rush Copley Medical Center in Aurora, and if they die, their death gets logged in Kane County. Here's why that's a problem. So many of these dollars, including the grant funds that were just appropriated by Congress last fall, are administered through programs that are given to communities on a competitive grant basis, meaning that the communities that can demonstrate a need, i.e. have higher numbers of deaths on record, get the resources. And so it ends up pitting these communities against each other. And that's problematic in our area because we have this variable level of deaths on record, and yet we know that fentanyl and heroin and all these drugs are in each and every one of our communities. The nature of our drug crisis has changed from the 80s and the 90s, where you could maybe pinpoint on a map where crack was, or you could maybe pinpoint on a map where meth was. It's not like that anymore. And so I believe that we should have a system where every community gets the resources that they need to treat addiction as a disease. This law enforcement only approach, I believe, has failed. And if we're going to be offering resources to communities to help move people into treatment and recovery, those resources need to be offered to every community. And so what we are doing is trying to find a way to do that, to change the rules to make sure that every community can access these really important resources. So that's one thing. The second thing I think that we need to do is really have an upfront conversation as a country about mental health. We know that people are not accessing the mental health services that they need. And there's many reasons for that. My dream is for our United States to have mental health clinics at every strip mall like we have massage envies here in the 14th. Can you imagine? Honestly. And the barrier to getting there is significant. One, we don't have the workforce right now. We don't have the number of psychiatrists and psychologists and social workers and mental health nurse practitioners and all these different mental health professionals to do that work. We need to increase that pipeline. The second challenge is regulatory. So many of us have insurance plans that require you to go see your primary care provider and get a referral for a mental health specialist. And while that seems like if you are somebody who's on top of all your medical appointments and you have your chart together and you are going to make and keep all your appointments, that's great. But A lot of people just don't have the ability to do that, and so it ends up being a barrier. And so what my team is doing is working to figure out how to move access to mental health to have parity with access to primary care. So the way that primary care works, everybody gets effectively a free physical every year, right? And that applies before your deductible. What we're looking at is trying to move access to some mental health services so that everybody would be able to access a certain level of introductory mental health service visits in the same way. We haven't quite found that pathway yet, but that's what we're kicking around in our office and talking with experts to figure out how to do it. And we'll be excited to come back once we figure out a solution and explain it. But I think that would change the way that we look at mental health as a country, because right now there's so much stigma and people who need help just aren't able to get it. And so I think it's a resource issue, it's an administrative issue, and it's a cultural issue. And we can make progress in all three. Thank you.
We have a question over here.
Hi, Lauren. My name is Tom Cleveland, and I live in Sycamore, and I'm the airport manager at DeKalb Airport.
Yes, nice to see you again.
Last time we were together,
Yeah.
you and I were driving down the runway together, and I was
That's right.
explaining to your projects and everything. I just wanted to tell you, we do need transportation improvements in the county and at the airport, so I would really like to come discuss that with you at your district office or even in Washington. So I just want to say hello to you. Thank you for coming to the airport on one of your campaign stops. So
Thank you.
congratulations.
Well, I drove past the airport on my way here tonight and was reminded of our nice afternoon there and the opportunity to bring some resources to help make the airport all that it can be. Really excited to work together, so thank you.
We have another question over here.
Good evening and welcome.
Thank you.
My name is John Linderoth. I'm a citizen of Sycamore. We have an impending problem that's going to come crashing down on either our children, grandchildren, or great-grandchildren. It's called the federal debt. And we have challenges to so many of our social programs, especially Social Security, Medicare, Medicaid, and a host of others. What is your game plan for getting us a surplus so that we can get out from under this?
Okay, thank you for the question. I think at a very high level, solving for this problem should not come at a decrease to the earned benefits people have from Medicare, Social Security, and the critical protections of Medicaid, number one. What we know is that the tax Cuts and Jobs Act that passed in 2017 added over $1 trillion to our deficit, $1 trillion. And that is not sustainable. And you're right, sir, that it's not the current population of workers that are going to pay off that debt. It's our kids and maybe their kids. And so it's irresponsible and unaffordable. And so I think that the way that we change this ship is, I think, in a few key areas. One is not adding to it. So one of the things that we've done is change the rules of the House. As we're passing bills, they have to have a pay for associated with it. And that's something that I think is important. And it requires a lot of discipline and creativity, but it's something that I think will set us up towards long-term success. The second thing, you mentioned Social Security, and there's a bill that I'm very excited about. It's called Social Security 2100. And it's a bill that will allow for Social Security beneficiaries to get a small increase in their payments. It ensures the long-term sustainability of the Social Security program, and it does that by lifting the caps. So as you know, in the Security program, last year it was 128,000. I think this year it's like 132,000, something like that, of someone's salary is taxed to Social Security, and that's it. So you have people who are making $400,000, $500,000, $2 million, $10 million a year, and only that first $130,000 is being contributed to Social Security. And so if we lift that cap, we're able to shore up and reinforce and strengthen this vital program that we know has protected workers and retirees into the rest of their lives. And I think it's very important. And so that bill is one that we're, I think, poised to pass this spring. And again, I think that we should all focus our efforts on the Senate to make sure that they take it up and give it due consideration in that chamber as well. The last thing I'll say is this. The way that we treat the Tax Cuts and Jobs Act is one that we have been given some real consideration to because of this SALT deduction problem that I mentioned before. The reason that we have not come forward with a solution yet is that Sean Cassidy and I have been going back and forth with the economists, honestly, to try to figure out how to do this in a way that does not add more to the deficit. And I think that's really important. And so while I think a lot of folks had hoped that we would just be able to just undo it completely, undoing it completely could cost like billions of dollars. And I think that there's probably a sensible way or a solution where folks like hardworking families across our district, across the state of Illinois, California, New York, New Jersey, the 4 states that were laserly targeted and punished in that tax plan can get some relief without creating this unsustainable burden for the rest of the country and generations to come. So we're working on this very important issue, but I think that the most important takeaway is that we've acknowledged it and we're trying not to add to the problem.
Hi, Representative Underwood, Jerry Smith, Mayor, City of DeKalb. Nice to see you again.
Nice to see you.
Last time I saw you, you were a candidate. We were at the DeKalb Airport. You know, DeKalb, we only have a small sliver of the city of DeKalb in the 14th Congressional District.
That's right.
But our airport is in the 14th Congressional District. And like Tom alluded to, we appreciate you coming out there. I'm not going to talk about the airport tonight. My question is twofold. As you know, our new governor, J.B. Pritzker, has campaigned on 2 rather controversial arenas. One, he signed, I think, today, and that is the minimum wage, which will be a step through 2025. My question is, well, let me put part 2. Part 2 is he has campaigned on legalizing recreational cannabis in this state. There's a very good chance, from what I understand, that that has some pretty good legs to it, or may. My question is, and if you care to comment on either of those issues and where you stand, I'd appreciate that, but my question is, do either of those issues, the minimum wage or the legalization of cannabis, have any momentum on a national scale?
Thank you for the question on both of those items. So let's take the minimum wage first. We have a bill before Education and Labor right now to raise the federal minimum wage to $15 an hour by 2024. That same bill would also phase out the tipped minimum wage by 2030. These are very significant changes, and we in my office are very eager to hear from all of you. So if you have strong feelings on this, please reach out and let us know. Okay? Everybody promise? Okay. And I think that you're seeing this trend towards minimum wage conversations happening all across the country in different states and municipalities having even city or county-wide minimum wages. But it's come to the federal level, and we want to know how it would impact you, your family, your business, etc. Regarding cannabis, at the federal level, the majority of the conversations that I've heard have been related to banking, because so much of the cannabis industry is cash-based, because the federal level has not kept up with the changes of the state policies, right? And so we have states that have legalized medical marijuana, we have states that have recreational cannabis, we have states that have some kind of hybrid policy. and these dispensaries, that they don't have bank accounts associated with it. And so it's my expectation that in this session that there will be a fix for that on the banking level. I don't know about anything else. Just to be honest. But I think the banking fix is important. That is not minor, so. Thank you.
The other question over here.
I am Matthew Cleveland, and I'm a citizen of Sycamore, and I was a member of the STEM Scholar Program under former Congressman Holmgren last year. And,
congratulations.
well, thank you. I was really presented with a bunch of unique opportunities, which I wish that other people in future will get to experience. So I was wondering if you would maybe consider restarting the program this year.
Thank you. I've heard that it's so popular and people really enjoyed it. And so we're certainly eager to continue to encourage all of our students to go into STEM careers and to see the possibilities there. And so I'm open to it. I think the team's open to it. And so maybe expect some good news soon.
Karen Salmons, I live in Sycamore, and I also work professor at NIU. So as a scientist and as a parent, I'm really concerned about global temperature rising and greenhouse gas emissions, and sort of the legacy this leaves for our children. So I want to know, what do you see as the best path forward for dealing with the climate crisis?
Well, I think that let's say it like this. We have a Congress that now acknowledges and recognizes that the climate is changing, and that we're able to have this proactive, upfront conversation about it that's solutions-oriented. That in itself is such a dramatic change and shift. We have a new committee, the Select Committee on Climate. I'm very excited about the work that they're going to do because here in the 14th, we are so directly impacted. At the end of 2018, I'm sure you saw it, but for others, there was a report that was put out the day before Thanksgiving. I think that the administration was trying to bury it, honestly, because the news that was in that report was so severe, saying that the Midwest of all the regions in the country, long term, is expected to be the hardest hit by climate change, which was significant because a lot of people thought it was going to be Southern Florida, Miami, something like that. No, the Midwest. And that we were going to have a significant economic hit because we were expected to have corn production decrease 75%, soybean decrease, and that is going to just devastate our rural economy long term if we do not act to make a change. And so, you know, one of the things that I personally am very concerned with, if this is the Trump administration's report and it's that harsh and they were trying to throw it out, what didn't make the climate cut? What did they scrub out of the report? And what are they not really sharing that maybe some scientist someplace is tracking, right? So we know that inaction is not an option. It is my belief that we need to have a strong, fully funded, fully staffed environmental protection agency to do this critically important oversight work. The EPA is the only agency that we have at the federal government level that protects the public health in the face of pollutants, contaminants, and does this really important climate science work. And we have an administration that at every turn has tried to defund, delegitimize by preventing scientists from offering their expert opinion to inform the decision making, and placing now a coal magnet to run the EPA. It is incredibly concerning and unacceptable. And so that's an area where oversight, I think, is going to be incredibly important. And making sure that we continue to, again, fund that agency to do the important work. Probably an hour and a half from here, there was a company called Sterigenics. Everybody hear about this? That in suburban Chicago was pumping out this chemical, ethylene oxide, that was linked to cancers. And the EPA refused to act. The EPA. And so we had, under Governor Pritzker's administration, right, they in the last week just shut it down. But at the federal level, we are continuing to follow up with the EPA to ensure that they are doing that important monitoring work and enforcement work across the country, but certainly here in our region where we know that these companies are skirting the rules and not complying. I think that's really important. The last thing is resources. We have got to be devoting the resources both at the government level and at the academic level, right, to institutions to be able to do the important work to investigate what's happening in our planet and to fund the work that we'll need to do to reduce carbon emissions. I don't know how to say it more plainly than that, but the current posturing is not sustainable. And I'm worried about what the future looks like if our approach to this issue doesn't change.
Question here? Hi.
Hi.
I'm Chris Thompson. I'm from Sycamore. I've been in the tax field for 30 years, and I want to tell you that the tax code we're currently under, besides SALT hurting people, we're also hurting our traditional American families. We need to make, and we talk about gender neutral, we also need to make our tax system marital status neutral. Everyone should file their own taxes as people, young people, old people, everybody are not getting married because they are getting hurt on taxes by being a couple. And those children in traditional families should have the same opportunities and have the same support that the children of non-traditional families. And so I would like to see some proposal done to neutralize that family bias in our taxes. And what could you do about that? I would hope that maybe we could do something to help all the families and not just the ones that are non-traditional.
Thank you. I am admittedly a little less familiar with the contours of what you're describing, and so I'm hoping that my team can get your information so we can set up a meeting and discuss it further. Thank you.
We have a question over here.
My name is Corky Williams, and I live in Sycamore. And in 1995, my husband and I brought in a handicapped child with handicaps, who was 6 years old at the time. He's now 29 and living in a group home, and that's all wonderful. But he's Medicaid. That's his only insurance because he's never been under our insurance or anything. And we chose a family doctor for him who is great and so forth. But in the Medicaid, we had to choose a insurance company, a Medicaid insurance company. So the primary doctor is here in Sycamore, and that's wonderful, but none of the specialists that he needs are within a 30 or 40 mile radius.
Right.
You know, a pulmonologist, a dietitian, I forget what else.
Yeah.
But, and so that's a real problem. Straight Medicaid would be wonderful. Is there any way to get it for him, or are we stuck with one of those insurance companies?
So in the state of Illinois, Governor Bronner transitioned the Medicaid program from traditional fee-for-service Medicaid into managed care. So that's what you're describing, that your son has to enroll with a private provider in order to get his Medicaid services. We can't go around that at the federal level. That's one of the flexibilities that's being offered to states as they design their Medicaid program. Because as you know, Medicaid is like a state-federal hybrid. Both levels pay into the program, but it gives states a lot of flexibility in the benefits that they offer and the way that they administer it. I think one of the things that we can do at the federal level is address the reimbursement rates. Medicaid reimbursement rates are far lower than both Medicare and private employer-sponsored coverage reimbursement rates, and as a result, there's many providers who just do not accept Medicaid patients because of the economics of it. And so it's my hope that as you can increase reimbursement to be competitive, more providers will decide to accept Medicaid beneficiaries, and then that helps to solve for the access problems that you're describing. Because they are considerable. And it's not just happening here in DeKalb County, it's happening all around the country. And as we know, people who have this kind of geographic distance from their providers, oftentimes they just don't get the care that they need. And there have been important advancements in telehealth that allow people to effectively like Skype in with their provider, but that doesn't solve for the whole problem. We need to make sure that people can get in and see a provider when they need to. And I think that reimbursement is a way to tackle that issue. Thank you.
Question right here.
Hello, my name is Clayton Schoffer. I'm a senior here at Sycamore High School. Tonight, you talked about protecting patients with pre-existing conditions, and you talked about defending and expanding the Affordable Care Act to help provide health care to as many people as possible. And the gentleman over there, we talked about combating the greed of the pharmaceutical companies, which is driving the opioid epidemic. So my question to you is, why not just take the full step and move towards Medicare for all, which would solve all these problems?
Thanks for being here and for your question. Let's take the prescription drug price first. So one of the things that we know is that prescription drug prices are off the charts far too high. And there's many reasons why. One of the issues that we've heard time and again all across the district is about the price of insulin, which has gone up to over $2,000 a month on private insurance, up to $2,500 a month on Medicare, and folks can't afford that. And a lot of the conversation that's happening on the Hill right now is about negotiating drug prices in Medicare. I think that's really important, and that's going to be an important advancement, but that does not solve for the whole problem. We need a solution, in my opinion, that allows for price negotiation and stabilization in the private market too. Because as we know in this diabetes example, that there are many elementary school age kids whose parents can't afford $2,000 a month for their insulin, and a Medicare-only solution doesn't fix that. So our team is talking with the economists and these experts to try to figure out how we can make these changes without having unintended consequences. Meaning you stifle innovation and make it so that we're not seeing these breakthroughs and cures coming out of the private market. And so I think that it will likely be a longer term challenge for us. Not to say that we are not going to act, but I don't think that the solution will come overnight. Does that make sense? But I am encouraged that we're having the conversations, particularly in the private marketplace. I think we're going to come to a solution for Medicare pretty quickly, but for everybody else, I think it's going to take a little bit of time. Now, with regard to Medicare for all, I believe healthcare is a human right, and that's been foundational to my life. Usually in these types of settings, I say to people, well, what do you mean by Medicare for all? And I get a few versions of ideas. Sometimes we hear people want Medicare 55 and up, which is lowering the eligibility age. Some people want it 40 and up, some people want it 18 and up, some people want it at birth. And then some people want a Medicare buy-in. There's other people who want a Medicaid buy-in. And they all somehow go underneath this umbrella of Medicare for all, which I think, again, is great that we are having this conversation as a country. We are having, multiple presidential candidates talk about their ideas and what they think Medicare for all means. And everybody has their own idea. Great, let's talk about it and decide what we want. My challenge here is, one, how much is it going to cost? And how do we pay for it? And two, we need to use the words in the same way. So when you say Medicare for all, it means the same thing to your neighbor and the person sitting in front of you and in back of you. Does that make sense? But I think that absolutely, in 2019, with the amount of money that we're spending in healthcare, that we should be able to have high quality, affordable coverage for everybody. And the question is, how do we do that?
Hi, I'm Sarah Ward. I live here in Sycamore, and I'm a teacher here at the high school.
Fabulous.
Welcome. Thank you for coming. I am also the mom of a type 1 diabetic and the wife of a type 1 diabetic. And so I appreciate your insight on insulin and its affordability. My question is a little bit bigger than that. When we look at the affordability and the insurance coverage of the care for chronic illnesses like diabetes, but there are many, what are you able to do in your position right now to forward the advancements of research and cure and not just maintenance?
Yes. So I think that there's a lot that we can do. The first is making sure that we are passing full budgets and not getting stuck in this cycle of continuing resolutions. As we know, scientific advancement doesn't happen on a 10-day continuing resolution cycle or a 30-day or 90-day, right? These are multi-year studies that need stable funding sources in order to do that work. Those kinds of studies have been jeopardized over recent years by the inconsistent nature of our federal funds and these lapses that happen when you have shutdowns. And so I'm encouraged that we are, well, first of all, I think House Democrats prioritize, regular order functioning, full year budgets, and certainly see the value in biomedical.
One that's often overlooked is the disabled unemployment rate. I'm a person with a disability. I was diagnosed with autism back in 2011. I just want to know, so with your position on the Education and Labor Committee, what you can do to help people with disabilities gain employment, gain independence.
Thank you for your question. I think you're absolutely right that we should have employment opportunities for everyone that wants to work, and right now we don't. Part of it is that a lot of employers don't actively seek and recruit. They don't have workplaces that are fully compliant with existing federal law to be able to employ individuals with different physical disabilities in particular. And I think it's really important to make sure that folks are in compliance with those existing rules and books. The second thing I think that we need to do is make sure that the apprentice programs and the things that we're funding at the national level, that we make sure that they are inclusive, so that in these areas of opportunity, like the hot jobs, that we know that folks of all different backgrounds, physical disabilities and intellectual disabilities, could receive the training towards employment, that they are being included as well, and that the incentives are being worked into those bills so that the employers are doing their work to reach out to these populations and groups of people who could offer tremendous value in the workplace. And so I thank you for raising it, and we'll be sure to keep it in mind as these different opportunities come across. And if you like, my team is here afterwards if you can connect with them so that we can share those with you directly.
Another question here.
Hi, I'm Deborah Booth from DeKalb. I got stuck on one of the earlier questions. At this point, with your committee membership with the Homeland Security, are you privy to how many children are still separated from their parents? Or are we waiting for Kirsten Nielsen to reveal that information in March?
I don't know yet. And so that's part of, I think, the challenge, is that DHS has not been candid and upfront with what they know. And that's part of the oversight responsibilities. I think we've got to remember, in the last 2 years, we had a Congress, or Republican-led Congress, that didn't want to ask the questions. And so now that we've had this change with the Democratic chairman, that we're asking the questions, it turns out our Republican colleagues have some follow-up questions. It's like now they have some permission to engage. And so I've been surprised, candidly, about the interest in these issues on the other side of the aisle, that they had just feigned disinterest and acceptance over the last 6 months. Now they really want to engage. So I'm hopeful that Secretary Nielsen will come in and be candid and forthright with what's going on at the border. And if not, the next step are document requests and subpoena requests. And, if we have to do depositions and all these other things to get the information. But right now, she's agreed to come, and we're going to ask. And I'm hopeful that we'll get some answers. Thank you.
Got a question over here?
Dick Larson, Sycamore.
Hi.
I want to thank you for
providing this wonderful forum.
Oh, thank you.
This is really the best that we've seen. I hesitate to take us off the real critical domestic issues, but this administration has pulled us out of international cooperation at almost every level to the point where our footprint in the world is seen as militaristic. What can we do to stop this?
So I think, as you've seen maybe in the news, this weekend there was a conference in Munich, and the House leadership went, Nancy Pelosi went and to represent the Congress, the Vice President went to represent the administration, and just as you described, that contrast was in full force. I think that the opportunity is, in terms of international engagement, the Congress has an important role in authorizing war and engagement. And as we continue to assert ourselves in that process, I think that our allies and partners around the globe will see that there are more people who are watching, who are engaging, and who are leading on this issue than just Donald Trump. And I think that is being seen very warmly by those allies and partners who had been, I think, a little bit isolated and alienated during this Trump administration. I see the United States as a world leader. It's important that we continue to engage with our partners and allies around the world to make sure that our interests are protected and that we can do this critically important work, and that we are not instigating fights or self-isolating from even our strongest, our closest partners. And that's also been what's happening. And we cannot be United States versus everybody else. And I think that the Congress recognizes that, and I'm hopeful that over the next couple of years we'll have some different outcomes.
We'll have time for one more question this evening.
Hi, I'm Mike Guy from Sycamore, Illinois. I had a question. You said that all your bills in this current House Assembly are going to have a pay for.
Yeah.
What's the pay for the recent omnibus? the recent bill that was just passed with the funding for the. What's the paid for? Where is that? How is it paid for?
So that's like traditional general spending. I'm talking about if I wanted to have a bill to say that every American who works for an employer-sponsored healthcare plan could see a psychiatrist twice before their deductible, that has to have a pay for it. There's going to be a cost associated with it. Let's say it's $10 million. We have to find a source of revenue for that $10 million.
Sure. What was the cost of this last omnibus bill?
I don't know. Sorry, we can get you that information.
$2 trillion?
We can follow up with you on that information, sir. Thank you.
Thank you.
Do you want to have your closing remarks this evening?
Okay, well, thank you, everybody, for coming tonight. I'm so excited about the opportunity to continue this type of engagement. A quick note about our offices. Right now, we are in Mr. Holcomb's old office in Campton Hills. We will be there through the end of this month, and then we are moving to an office in West Chicago. It's going to be on 38 and 59. We are also looking for an additional office space in the northern part of the district in Lake County or McHenry County. When both of those offices are open, you're going to get an alert, and we're going to have a party. It's going to be great, and welcome you all in. In the meantime, as you have ideas, if you have concerns, if you have feedback on what we're doing, please call our office. We want to hear from you. And I think that the team here, Jackie's here, Jake is here, they're in the office every day if you want to stop by. I'm here on the weekends mostly. And so we schedule a lot of meetings, so if you want to follow up on any of these items one-on-one, we'd be happy to schedule and set up a time for us to do just that. But thanks for taking some time out of a weekday night to come and talk about these issues of such national importance, and I hope we can continue the conversation moving forward. Take care, everyone. Thank you.
If you feel like you didn't answer tonight, be sure to write it down on your note card and give it to the representatives team, and she'll be sure to answer your questions.
Thank you.